to sum up, very good presentation. I just wanted to know that, as you have said, but for
Yeah.
the residents learning, if I want you to sum up in 1, 2, 3 points,
Yeah.
the differences in the conventional approach and in this Bangla approach,
Yeah.
and the advantages.
Yeah. As I said, there are three components. That is, one is spinal anesthesia. You know that if you give the spinal anesthesia, it will save you at least 15 minutes time. Before anesthesia, during induction, you will save a lot of time, and during reversal also you save a lot of time. Because your time and anesthetia's time is similar, only 1 minute or 2 minutes more anesthesia takes. So time saving, cost saving. You have, if you use general anesthesia, you have to use lot of drugs. Here the drug utilization is minimum, and in fact the spinal anesthesia was popularized in children mostly during COVID period, and it prevents the aerosol effect of the general anesthesia. We don't know whether there will be another pandemic or not, so it is a good thing. And for ergonomics, that is the positioning of the patient. In that you can also use a one less assistant, only one assistant. You have two hands, your assistant have two hands, no scrub nurse or a third assistant. So you can save some cost there, and you can also help infection prevention and control by minimizing the movement in the operation theater. And the last one is the dissection technique. You do not need to worry about common hepatic duct or common bile duct in this system. You are not going anywhere near those structures. You start doing dissection above the lymph node of land that is far away from the bile ducts, and just that they will fall down medially, and you will you have to deal with only cystic duct. So yes.
Sure.
Hello, Professor Will. This is Dr. Muhammad Ali from Sheikh Hospital, Lahore. May I ask a question from Dr. Jafar Hassan?
Yes.
Sure.
Yes.
Please go ahead.
Very nice presentation, Dr. Jafar Hassan.
Yes.
And
You.
it was really an opening for me that you are doing these procedures under spinal anesthesia. Just want to add into my knowledge. You know,
Yeah.
when we are doing laparoscopic procedures,
Yeah.
we have to have a muscle relaxation to get a proper insufflation. How do
Yeah.
you manage that in spinal anesthesia?
Okay. If the spinal anesthesia takes proper effect, it will do relaxation of the abdominal muscles for at least 80 minutes. In case of children, it is a bit less, maybe 60 to 65 minutes, but in adults, 80 or more minutes. So that is not a problem. And as I have been doing neonatal laparoscopy for long, almost 20 years, so I know how to do work in a very small space. So neonates, whatever gas flow you give, you cannot distend it much. So I know how to work within a neonatal abdomen. That's why I can work with keeping the pressure and flow very low, and that will not cause much pressure on the abdominal wall muscles. And the patient is kept sedated by ketamine anesthesia, and very rarely it needs other mode of sedation, that is diazepam. But ketamine one dose is enough, because the time requires is less than 30 minutes in children, because most of the children the cases are simple. In adults we get complicated cases, but in children anatomy and everything is very simple. It takes 15 to 20 minutes, so it is not a big issue.
Okay, thank you. My second question, if we have some time.
Yeah.
What is the advantage of sparing cystic duct while doing cholecystectomy? Why do you want to spare the cystic duct when you are taking out the gallbladder?
Yeah. The principal issue with the gallbladder operation is the injury to the bile ducts. And whenever you injure, if you do not injure the bile duct directly, if you somehow tear the vessels, that is very small caliber vessel in case of children during dissection, that may lead to bleeding, and if you go for control of bleeding, you may inadvertently injure the common duct, common hepatic duct, or at least burn some wall of the common hepatic duct, which will manifest after few days with the biliary leakage. So if we do not even go near the bile ducts, so there is no chance of injury to the bile ducts. Even it is very, nowadays it is 1% or 2% maximum in case of adult surgeons. In my case, there was no bile duct injury in case of children. So you are starting dissection at least 1.1 inch or more away from the bile ducts. So it is, you are nowhere near the bile ducts to injure that, and the beyond the lymph node of plant on the gallbladder wall, the vessels are only tweaks. You can manage those with only unipolar cautery. However, I use bipolar cautery to ensure more security. So that is the reason I do not handle the main cystic artery. That is not necessary. That's why I only need to clean up the cystic duct to ligate it. That is my idea.
Okay, thank you. Thank you so much. I hope, Dr. Ali, your queries has been answered. And rest
Thank
of
you.
the discussion can be carried on in the chat. And Professor Shilpa Sharma,